was when I used to be on the task force 15 years ago. So Jennifer, would you call the roll?
Okay. James Hepamaju.
Here.
Marga Antonetti. Angela Chu. Jordan Davis.
Present.
Raul Fernandez. Juan Garcia.
Present.
Shanita Gartner. Here. Clifford Gilmore.
Here.
Larry Kassler. Sam Patel. Dion Roberts.
Present.
Randall Sloan. And the legal advisor, Peter Keith.
Yeah, Mark Price will be standing in for that.
And you are?
Adaka Udes, subbing for Larry Kassler.
Yeah, Health Department.
Okay, Health Department. Okay.
All right.
Welcome, everybody. Thank you for coming. We do have quorum. So we have a guest speaker today, and then we also have a couple of things we have to do. The June minutes are for you. Does anybody have any changes?
I know, like, it's usually formed to put our full names, but it's done for most of everything, but it was like Clifford Gilmore and Jordan during adjournment just said Jordan, so just put Davis there, just to keep everything in form. Just Jordan Davis for the record.
Okay, thank you. Other changes? Okay, is there a motion to approve the minutes?
Motion to approve the minutes.
Dion Roberts. Is there a second?
I second.
Clifford Gilmore. All those in favor? Anyone opposed to approving the minutes? Okay, motion carries. Administrative announcements. We are on, what's it called, leave in August, recess. So the next meeting will be in September, Thursday. The Department of Building Inspection, Housing Inspection Services is in the process of reviewing our old outstanding cases, or our cases that still have violations that are outstanding. We usually go through about 10,000 violations a year. We get about 88% corrected. So the inspection staff is in the process of, are those for us?
Yes.
Okay. The housing inspection staff is in the process of updating their lists, making sure that we get all the cases corrected. We have a big case that we're working with Ms. Rockland that has been referred to the city attorney's office on Utah Street. We had the ceiling fall down there, and a number of other issues there. So what I'm going to do is I'm going to ask during this item if other people have announcements they want to make. Does anybody have other announcements?
Yes.
Yeah.
Health Department has a couple of announcements. We conducted a neighborhood walkthrough on the Tenderloin with Supervisor Haney to address the blighted conditions. We issued 3 notices of violations for 2 SROs regarding pigeon roosting, which was problematic and causing a nuisance in the area. We will be conducting a task force inspection on one of the very large hotels with the city attorney's office next month. We're working on the paperwork right now.
Which hotel?
The Seneca, 34 6th Street.
Okay.
We are in the process of moving the supportive housing units we inspect into our SRO program. We feel that it's a better fit. So we're going to move them from the apartments to the hotels and have senior inspectors do those inspections. That's about it.
Any legislative updates?
There are two. Apparently, a hotel at 937 Clay Street. Peskin introduced legislation to basically provide some funds to help rehab it, and I don't remember what it was, but yeah, and also there's going to also be a ballot measure around the HSH Commission. It's still pending before the Board of Supervisors. They're going to put housing and homelessness and support of housing into the under a public commission like the BIC and the Health Commission, as well as the I know Aging and Adult Services also has a commission. Like pretty much it's one of the few departments without a commission, and there's going to be a ballot measure around that in November.
That's for HSH, right?
Yeah, HSH Commission.
Okay. Any other announcements? Okay, good. Thank you. Is there any public comment on the announcements? Okay. Well, a number of people have been asking for more information concerning adult protective services. A couple of people had expressed, actually everybody here expressed interest. And Margot Antonetti helped get me connected with the director, the boss. So if you could
Hi.
proceed, thanks.
Well, good morning. My name is Achilles Cerrone. I'm the program director for Adult Protective Services for the city and county of San Francisco. I brought a couple of my staff, Gloria Wong and Dwayne Vickery. So I'll give you an overview of APS. I believe I have like 15, 20 minutes.
Yeah.
So I'll try to keep it brief with the overview and allow time for questions and answers. So to make sure that all your questions are at least addressed. Adult Protective Services, it is a state-mandated program, and it is county administered. So all 58 counties administer their own Adult Protective Services program. And the program is mandated to receive and respond to allegations of elder and dependent adult abuse. Abuse includes physical abuse, neglect, abandonment, abduction, isolation, mental suffering. Under neglect, there is self-neglect, so it is a subsection of neglect. And our target population are dependent adults, those between ages 18 and 64, who are dependent or should be dependent on somebody else to help them meet their needs, or older people ages 65 and over just by virtue of age. They don't have to have any type of like disability or limitation. And that they're believed and found to be in harm's way. Harm being defined by how California Code defines the types of abuse, including self-neglect. It is a social service program. It's a voluntary program in the sense that unless there's a penal code violation, we have the right to investigate without the consent of the victim. Also, if the suspected victim is believed to be an endangered adult that is likely to suffer permanent injury or death. We don't want to abandon those folks even if they refuse help. And our goal is to assess the adult's ability for self-care and self-protection. Based on their ability for self-care and self-protection and the resources available to them, if they're in harm's way, our goal is to help them enhance their ability of self-care and self-protection. So it's about the adult accepting services and connecting the individual with a network, so once we close our case, the protection issues are either reduced or resolved. adults have the right to refuse services, and if we suspect someone is incapacitated to the extent they cannot accept or refuse protective services, we discuss with multidisciplinary teams, all the way up to making referrals for public or private conservatorships of the person or the state if they need a surrogate decision maker. And in that path, our role is to explore ways in which the adult could be supported in their decisions, and while enhancing as much as possible their ability for self-care and self-protection. That's in essence. In San Francisco we have 45 APS workers, and we receive about 7,000 reports a year. About half of those are on self-neglect, and a fraction of those are individuals that are in a hoarding or squalor situation. We see those as different type of situations. Hoarding may not necessarily include squalor. Squalor poses an additional set of risks than hoarding, and in those instances we offer services to the adult, and when the adult is willing to accept services, we can design a service plan, and contingent upon working on a service plan, we could have objectives such as eviction prevention, safety, etc. Now, we are a short-term crisis intervention program. We're not designed by legislation to be an ongoing service. We're supposed to be a brief intervention to help stabilize the situation. And the key to the success of the program is to connect with a larger network with ongoing services that once we address or minimize some of the risks and close our case, the adult is connected with resources that will help them maintain stability after we close our case. The other half of the referrals that we receive, a large portion, are financial abuse, financial exploitation, neglect, physical abuse. So that's in a nutshell. I'll open it for questions, and I have staff that can help me answer questions.
So I have a question, Clifford Gilmore. So of the 7,000 cases annually, what would you say is your success rate?
So those are referrals. Very recently, we began a pilot where we're studying outcomes, and we're collecting data on outcomes. And through several trials, we've seen a reduction in harm. Recently, there's some pending data that the researchers from UCSF and Purdue, are about to bring. But empirically speaking, when the individual accepts services and works on a service plan, more often than not, we're able to stop an eviction, help them resolve the situation. That's in the case of self-neglect, or in the case of abuse by others. More often than not, we're able to successfully resolve the situation. The percentages I don't have, but in terms of recidivism for the same type of abuse, we suspect we brought it down on self-neglect and hoarding and eviction cases from a 15% to about a 9%.
Okay, and would you say that a fair percentage of those end up achieving the goal of stabilization?
I would say yes, for the same type of abuse, those who accept and engaged in services.
Okay.
And I do have a question, and thank you for coming out and talking to us. And this is something I've been doing a lot of research on. One of them is that, interesting enough, the rent board has like a web page on hoarding and cluttering. They basically say, attention landlords, blah, blah, blah. Please contact the Adult Protective Services Union of the San Francisco Department of Social Services before an eviction notice is based on hoarding, cluttering behaviors and it basically talks about a lot of the, what they can do. Like, is there like some kind of like requirement that, that landlords contact APS, if a tenant is hoarding or cluttering and it's causing a issues, like is there's like any requirement that they try to reach out to you before evicting a tenant?
I don't know what requirements landlords have. What I do know about adult protective services, the California Code has a set of mandated reporters whoever meets that definition is usually social service agencies that work with people with disabilities, older adults, fire departments, police, etc., public agencies, physicians, clergy, banks. Whether landlords meet that criteria, I suspect they don't, but I don't know. And I don't know if there's like a city ordinance that requires them to do that.
Well, that might be something to work on. And as a tenant, like eviction protection is very important to me. And just one more brief question: is there like any collaboration with the sheriff's office around evictions? I was reading something from the New York City Marshal saying, like, that the marshal must, if there's an elderly or disabled person, like, must, like, try to connect social services in case of eviction proceedings.
Sheriffs, they're mandated reporters, the same as police, and we do receive cross reports. Are mandated to cross report suspected instances of abuse, which includes self-neglect.
I just want to add one thing. I don't know what exactly the language on the rent board instruction for the landlord to report to APS on eviction cases, but usually applies to tenants who fit the APS criteria, meaning elderly or dependent adult. So it won't be like any eviction case then call APS.
But if it's like an eviction case where there's like suspicion that that the person could be eligible for APS services.
Mm-hmm. Yeah, then that will be appropriate.
Suspecting it is an adult with a disability or an older adult. If it is an adult that is not a dependent adult or an older adult, for example, they wouldn't be eligible for adult protective services.
But like a senior or disabled
Yes.
tenant could possibly they possibly could take a look at it.
Absolutely.
Can you identify yourself too? Because I'm on the recording.
Gloria Wong, I'm one of the supervisors.
Okay.
Okay, so Raul and then Dion.
Thank you. So, quick question, it's actually a couple of questions. I was wondering about concisely what services APS provides for, let's say, in terms of big adults that suffer from hoarding and cluttering. Like, do you offer anything like cognitive behavioral therapy or any other services that are tangible that we could discuss?
Yeah, I'll let Gloria answer that question since she has worked closely with that population, hoarding and cluttering.
Well, we have like two different approaches at APS. One is the very short-term crisis intervention to stabilize crisis situation, and then delegate to the community partner for continuing follow-up. So that's what Achilles just presented. That's the majority, the approach of the majority of the social workers at APS. We do have a group of social workers that do short-term, not long-term, short-term intensive case management of people who is high-risk self-neglect, and recently the focus is on eviction prevention. And that's our Home Safe pilot project. So in that particular pilot, the social worker will do short-term intensive case management, including some clinical intervention, such as harm reduction, motivational interview. Cognitive behavioral is proven to be very effective on working with people with hoarding disorder, but it's usually still a longer-term therapy. So we don't usually have the luxury, don't have the time to provide that. But I see that the social workers, because they have clinical backgrounds, and they would use some of the tools from CBT on their engagement approach. So, but that won't be the the focus of the approach.
Okay, Dion.
Hi, thank you for being here. My name is Dion, and we operate a couple of buildings in San Francisco for formerly homeless women, and our population, which is probably across all, permanent supportive housing populations, are becoming, well, it's an aging population, and we definitely have made our share of phone calls, concerned about our adult residents, lots of hoarding and cluttering, and also just a lot of self-neglect, and part of that is because of just their, physical impairments, mental impairments, just not able to. So I have, I can say that I've seen APS come on site and work with our residents, and then oftentimes there's follow-up resources as well. Some of my questions were already kind of touched on, but I'm wondering, specifically when you talk about a service plan for a resident, what does that actually entail? What steps, how much time is devoted to follow-up for the service plan and actual, achievement of the service plan?
Yeah. So for an individual facing eviction that will be part of our Home Safe pilot, for example, the follow-up is more frequent. The type of service plan will revolve around what is it that we need to do most immediately to help reduce the harm and avert the eviction. Is it to help clean up? Is it to maybe there's a pest issue and we can discuss pest prep? Would the individual be there to oversee, if they're moving belongings or getting rid of things, and are they willing, right, and approving? So it's about what needs to be done, what they're willing to do, and if there's a cost associated that is within our framework, we can purchase some goods and services to help address that immediacy of that situation, and following up with the connections and referrals for longer case management. That is very important if that's what is needed. For example, it could be that someone maybe needs in-home supportive services and they don't have it. Following up to make sure that that service is in place. For a situation where there is self-neglect and hurt, and maybe eviction is not as imminent, we would follow the same steps. The follow-up is not as long as with our intensive case management. So it is, in essence, designing the service plan with the client input, addressing the issues that need to be addressed for the reason we were called into the situation, and follow up on the resources to see if they took hold or not. So that's how long that takes. It could take about 30 days to 90 days, depending on the situation, the level of engagement of the client, the level of cooperation, and their willingness to work with us and accept the services.
Okay, thank you.
Angela?
I have a question. In terms of catering, what will you do if you go to an SRO and the room is filthy, filled with things? What do you do then?
If the room is filled with things,
It's a hoarding, catering.
a hoarding, cluttering.
Serious case. What will you do?
The first thing that our social workers do is assess the situation in terms of what is creating the concern. Is it that it's blocking some fire escape? Is it next to a stove? What are the issues? And to begin to, address those, and also discussions about, what can be done about that, and what is the client willing to do, because these are personal belongings of people. People with civil rights who have the right to liberty, right to property, and you cannot just go in and just move their things. So assuming that they are willing to part with their belongings, with how many, and what would it take, and whatever they're willing to do, would that satisfy any of the reasons they're facing, the harm or the eviction or the situation in that case. So pretty much our primary role is connecting with the adult to see what the adult is able and willing to do, what they're able and willing to do for themselves, what they're willing and able to accept to improve their future ability to maintain, what is needed. You're mentioning, is there a mental health issue, is there a medical issue?
What if the person is incapable of taking care of themselves, and they couldn't make the decision that they're going to part with whatever is cluttering in the room?
So that's when we think someone may need a surrogate decision maker, and what level of surrogacy they need for decisions. It is depending on who is available and willing to help that individual. Do they have a case manager or a program? How impaired they are? So it could be on, let's say, shades of gray, from the most minimal intervention and support in decision making, all the way to referrals for a probate conservatorship of the person.
What if that person is by themselves? There's no one to help.
And they're incapable of understanding what is being proposed to them and discussion. That is usually when if they have nobody, we make a referral to the public guardian's office. They will do an inquiry to see if that individual will meet the criteria for a public conservatorship of the person and the estate. Then they would file with the probate court. They're assigned not only a probate court investigator, but also a court-appointed attorney to represent the individual in a due process proceeding. And it is really discussing in that public forum the risk versus the right to self-determination, the right to make bad decisions. Are they understanding? Do they have decisional capacity or not? And usually that's a process that it is not short, and they have legal representation, and then the court makes a decision if somebody else needs to be legally appointed to make decisions on their behalf or not, and then another agency and program takes over that part of that person's life and case.
Can I add something? So before we get there, that's the most restrictive approach to make a referral for a probate conservatorship. Before that, we usually need to try, all different possible things to see if we can help that person make progress, be safe. So after all of those fail, and if there's absolutely nobody involved, then conservatorship will definitely needs to be considered. But we do need to try all of the other options first.
So what are the other options?
So let's say it's the very first time coming to APS. The client is isolated. There's could be cognitive impairments or other type of mental health issues affecting the client's capacity, decision-making capacity. Then we need to work with medical providers, mental health providers. We need to see if the client is still willing to work with us, to be connected with social services providers such as case management, intensive case management, and the cluttering.
What kind of case management?
Case management could be just community-based, or it could be case management offered by behavioral health with the mental health components to it. So depending on the client's situation.
What would be a community-based?
We have a list of agencies providing case management for elderlies and dependent adult in the community, such as Institute on Aging, Kimochi, Curry Senior Center. There's like a list of them, about 15 to 15 at least, that's contracted with aging and adult services, plus, there should be others too. Yeah. So we also would try to search for relatives or any possible support of that person and try to pull them in. So after all of those fail, and sometimes could be money management too, because one of the major function that they're not able to carry out is money management, and then a lot of time it will result in eviction because of non-payment of rent and non-payment of different utilities, and yeah, so a lot of things need to be done and tried, and if we're not making any progress, definitely we need to bring the case to the next level.
Yeah.
I was just going to say that Dion Roberts, yes, it's a very long process. For example, once a month we do what's called, the pest inspection. We bring in a technician and we go to every unit. And if our inspector can't get inside the door, can't do a proper inspection, then technically that is a violation. But, before we even get into eviction proceedings and all of that, we engage APS, and just, month by month by month goes by, and every effort is made because it's up to the individual to decide, if they want to receive the help. But it is quite a long process, and we have on-site case managers, and then a lot of times APS gets involved, and it's a lot of triaging, bringing in other third-party, community-based organizations, and what have you. But it's a very long process, and even without there being anything in our, lease agreement that says that, before we take any legal action, we are required, to call APS, even before without having that anywhere. It's something that we do automatically, because I think most of us at Master Lease, we are in the business of keeping people housed, but these are just very long, it takes a long time to finally get to the point. That's why I was kind of asking about, service plans and what have you. It just takes a long time to help the person, see, first of all, that they need this help, and then to, take the initiative. Yeah.
Clifford Gilmore and then George.
So, Clifford Gilmore, very briefly, I have a question regarding capacity. So, having 45 APS workers, does that represent full staffing for that
Well, assuming nobody's on leave or on vacation, yeah, it would be. But those are all the positions that we have.
Okay.
Now, is it enough? I don't think so. To be successful, you need time, and you need money for purchase of goods and services to help in those crisis situations. Time and money, and the only way to make time is to have more staff and have a lower caseloads for that.
That was what I was going to get to next. What's that sort of average for your workers for a monthly caseload?
That's about 25 to 30, depending on the month.
Very high.
Yeah,
Very high.
and different types of abuse.
Yes.
And then you add to it the components. So the code pretty much says that an adult has the right to refuse services. You cannot force services onto people. So it is a fine line between trying to detect when we suspect decisional incapacity and what's the risk. And depending on that, we don't want to abandon people either.
Right.
So, we have different approaches. And right now, the one that we have with HomeSafe is if there's imminent eviction, then that helps in the sense of, okay, well, if they're refusing services, but there is this, and there is self-neglect, and this criteria is met, we're going to try harder and provide intensive case management. So.
Right, and I would say that what you all do is very vital work, very challenging work, but very much needed. Thank you.
Thank you.
Jordan.
Yeah, so I would like to agree with Cliff that it's really great work, but I'm getting some, I spoke to some people before this meeting about APS, including some THC frontline workers, and I've been getting some mixed messages. Sorry if I'm on my phone, but I just got this email in. And it says APS, this is from someone high up in THC, APS differs vastly in its approach from caseworker to caseworker. I recently asked the case manager at THC to refer a client at risk of eviction for hoarding to APS. And APS turned the client down because he was already involved with case management, i.e. his THC case manager. We waited a week, then resubmitted, and the client was accepted, and basically that ended up being a success story. Like, can you speak to that issue of like how that interplays with case management in nonprofit hotels?
Yeah, I don't know how long ago that was. Recently, we've been going through a period of transition where we're standardizing how we approach or screening of these type of situations when someone is facing eviction, because we're starting this new pilot project as of July 1st.
When you say standardizing, you mean having a consistent procedure that everybody's following.
Right, in the sense of if someone is facing self-neglect and they're part of our population and they're facing eviction and they're self-neglecting. And in terms of the what the workers do when they go out and assess people is also part of a new pilot that we just ended. Now we're implementing it as of I would say June when we started. So you know, that's our goal, is to standardize how we approach every situation and the type of screenings that we do. We also have an integrated intake that takes intake for multiple programs. So when someone makes a referral or a report, these are assessed by our integrated intake, and then it comes to our APS program. So sometimes there is, and right now there's a lot of discussion in how we are implementing our Home Safe program, educating our intake about it. Yeah, but if someone is making a referral and they strongly feel they should have services, you could request integrated intake to, you know, connect you with an APS supervisor.
And another letter I got from another former THC worker who's also worked in Conard House, like, they said, like, in terms of like the training for staffers, I think the training for frontline social workers, what sort of situations to call APS, really vary from agency to agency and hotel to hotel. And for instance, I've had really helpful trainings on APS reporting from supervisors during my time at Conard House, and no training on APS reporting at THC. And he also said that he never thought to connect APS reporting to hoarding, cluttering, and other property management-related eviction protection issues, because I've been mostly trained on in connection to DB, mutual dependency, harassment, and grave disability circumstances. So how is your agency interfacing with the supportive housing network around making sure that there's a unified strategy to train caseworkers on the full scope of APS services and reporting circumstances?
Yeah. So we've had recent discussions with Marco Antonetti as part of our Home Safe pilot, and we're beginning to interact a lot more with HSH, with at least Margot's group, and our plan is to continue on that process since our pilot started. And so anybody who requests a presentation from us, we provide that presentation in terms of reaching out to supportive housing, and that is part of the process we're engaging currently with HSH.
And I was just going to add that, you know, definitely it's incumbent upon each provider and their case management staff to really be aware of all the resources that are available through APS, through IHS, and what have you. You know, it's incumbent really on the provider to make sure that they are up to speed and knowledgeable as to what resources are available.
Ben says, I'd also like to add that, our training was done by the supervisors on mandated reporting and the likes, is essentially on a request basis. But we do have grants with 2 community-based organizations for elder abuse prevention that are our kind of messengers out into the community. So the Institute on Aging and Apilo API Legal Outreach both receive APS dollars to do mandated reporter trainings and other EAP outreach to the community to try to get out there. But if there is variance, it is good for us to hear. Because a lot of time it is based on requesting more information and training.
Could you state your name for the record, please?
Ben Cesteros.
Thank you.
Can I add a little bit to the first email you read about request to APS to address some hoarding issues? And there's like different responses, right, from for different cases. So I just want to state that hoarding disorder is a very long-term chronic illness. It's not something that there's a quick fix. There's like a one-time treatment and that's it. The behavior is going to be gone. It's a lifetime struggle of the client. So it does make a difference if the home is hoarded, cluttered, and the client is going to be evicted because of that. So that to APS is more of a more inward protective issues that we need to find ways to address. But it is like the home is hoarded, cluttered, may or may not be due to hoarding disorder. And there's community provider and some client even have mental health provider addressing that hoarding disorder behavior with that client. And doing it, because the treatment needs to be baby steps with people suffering from hoarding disorder. There's no overnight solution. Baby step, make progress, little insight at a time, and a little progress at a time. So if that's the problem, if that's the reason for the referral, and if there's already an appropriate provider in the community addressing it with the residents, then yes, the screening on APS side will have a different decision about whether or not APS should be involved. So I just want to point that out. So there's even though it's hoarding situation, there's a wide range of hoarding situation and what interventions needed at certain stage of the case.
Yeah, I was kind of worried because I saw from the email that they said that apparently case management, they said they already had a case manager, even though they may not necessarily be experts on hoarding as someone from APS would be, and they even said that after they resubmitted, they found that they were somehow eligible for services. So I just wanted to point out that there's been some consistency on the ground.
Well, yes, like Achilles said, it's being definitely being discussed.
That's a good question. Who's involved? What type of case management they're currently having. Very good. Thank you.
We'll take public comment in just a second. Are there other questions directed to APS?
Yeah, just a brief one. Wondering, Achilles, if you could kindly elaborate a little bit on the eviction prevention services in terms of, let's say, a hypothetical scenario of somebody in self-neglect, let's say, whether a combination of mental health, substance abuse, dual diagnosis, you name it, right? This person is having problems like paying the rent or whatnot, and is at risk of eviction. What kind of response would I be providing in situations as such?
Yeah. Well, looking at the eviction, first, Gloria can speak more as to the general type of services that we do every day, but certainly most immediately connecting the... often when we receive a referral like that, we have to move very quickly because of the eviction process. and not knowing about it too late makes a difference. So ensuring that that individual has legal representation and that there is room for discussion and assessment to see, okay, what exactly needs to be addressed most immediately to resolve the eviction. And then we go from there, depending on what the specific need of that situation is. Maybe the individual is in a squalor situation and they just can't be there at all. Where can they go temporarily while that issue is resolved? We have access to emergency placement if the individual is willing, while an extreme situation is being dealt with, and it will resolve the eviction, and we can develop a plan so that the individual returning can have the resources to maintain, or the chances of maintaining, a safer environment that will not result again in the eviction shortly thereafter. That's an example. I don't know if you want to add any examples of.
So what's your question?
So in regards of adults that exercise like self-neglect by, let's say, mental health, substance abuse, and then they're at the risk of eviction, what kind of services we could provide? Like, is there like rental assistance, legal representation?
Anything you can think of, we can try to connect, but it will be just more challenging because of the individual's substance abuse situations and mental health illness. So how willing they are to engage with us, that's the key. Yes, legal services available, rental assistance could be available, there's all these services out there we could connect them with. But how much we can engage the client to work with us, that determines how deep we can go.
So you're working with the client to access other services that are out there?
Yeah, I would say that's our main role because we are short-term. So we want to make sure the client get the support that they need to, continue on. And like Achilles said, if the client willing to work with us, we have a lot of successful stories. But if the client refuses, and they do have the right to refuse, then we may need to try again next time when things happen. So we do open reports if there's new situation, new incidents, then we'll go out again and try again.
Margot Antonetti has joined us.
Yeah, I'm sorry. I had a situation at work. Margot Antonetti, for the record. I just want to do a little shout out, and I'm sorry I missed the presentation because there's so much that I still don't know in spite of working with you quite a bit. But I just want to do a shout out for Adult Protective Services and the work that they've done with us in permanent supportive housing. Like Gloria says, it doesn't always work out, especially because residents do need to participate, and they may for a little while, and then they may not, or they never may. And in fact, it's often the housing staff that might call Adult Protective Services as like yet another community resource, a very strong community resource. But I've been working with them lately on a very, very difficult situation, and I've been really, really impressed with the work that we're doing together. I did not know how much of a leadership the group would actually, or the particular social worker would take. And it was really, really impressive, and also really helped in terms of people, all the people involved knowing their role and their lane, and not everybody calling addiction prevention, not everybody doing certain things, really organizing that, and I really appreciate the work. And in this particular case, we may or may not be successful with our specific objective or goal, because there still has to be participation, but I think everything we're doing together is helping the resident and is going a step further than we would be otherwise. So big shout out. And that was one of those cases that had been opened and closed several times, and we were able to reopen it. Thank you.
I have to say this type of meetings, collaboration is the key to the solution of this challenging situation. Like working with Margot on, some cases, not just APS and the housing staff involved. There are DPH, there's mental health, there's attorney. So it takes a whole team to work on an eviction case or any type of very high-risk case and bring some success. May not be a full success, maybe just stop this crisis for now, and then things may come up again and we'll have to work again together. So just this meeting is the key to the solution.
Angela?
Can you tell us of the cases you have? Are they more single adults, seniors? What type of cases you get from families?
You mean like people living with their family?
Yeah, like our SRO families. Are there cases that you see from a family?
Or like an entire family?
Yeah,
Who lives in a
sure.
hotel room.
Oh, I see. So if there is an older person or a dependent adult living there, that would be one of the environmental factors that we would assess to understand the circumstances. We don't serve the family as a whole, so to speak, but sometimes the family is important if they're living together as part of the solution of what may be happening there. I don't know if that answers your question.
Like, what percentage would you say are single adults, seniors, or
Like living alone?
Can you give us some examples where families might be benefiting from the APS services?
So I don't have numbers like right now with me to say this many people are living alone facing eviction that we're servicing versus people facing eviction that live with families in SROs. Empirically speaking, it's not the majority. The majority of the cases are people, adults with disabilities, older adults living alone by themselves, not with siblings or children or.
Just to add to Angela's question, so just anecdotally, like of the 7,000 approximate, claims that you get, so you're saying that a majority are single adult households, shall we say, or individuals?
Well, those are reports of all types of abuse, not only for self-neglect or eviction type of thing, because we receive reports for all kinds of abuse, and often people live with their children or with a spouse.
Right.
On over. So if it is about people living in SROs facing eviction or hoarding situation, that is not the 7,000 reports that we get in a year.
Yeah.
So to your question, so we receive over 7,000 reports, which actually represents around 3,500 unique individuals. Right? We get a lot of repeat reports in a 12-month period. And of those, we're referring to those unique individuals as the person who's the victim of potential abuse or self-neglecting. So sometimes it could be a husband and wife, or partnered, and that would count as two clients, two cases. And so in our data collection, we're not we do have a section where we collect the living arrangement, but that is, and so we collect information if they live alone, or if they live with the suspected abuser. But we aren't necessarily collecting, they live in a multi-generational household or anything of that nature. So we don't have rich information about like the real living situations for all of our clients. So we do have quite a few people that are elders living in Thornville. And I would suspect that often these are the ones living in the SROs.
Okay, Jordan and then Margot, and then Juan.
Okay, so apparently Dion alluded to this a little back, that there's some type of requirement that supportive housing providers report to APS in cases where they can help, whether it's a senior or disabled tenant. But have you tried any collaboration with the private SRO owners? Because it's kind of a they're nonprofit and then they're private SRO owners, and that's a bit of a service gap right there. That and plus, like, tenants not in private SROs are much more vulnerable to eviction.
You mean educating them about what APS does?
Like, educating on APS does, the full scope, and like what to do, like, because private SRO owners may not always be trained on it, and there might be other things that are dealing with this.
Mm-hmm. Yeah, that's a good question. That's something that we can definitely look into.
And I'm really, for me, and I will say that I'm willing to actually make a motion on this, that it really needs to be a requirement when, if a landlord like sees that there's a senior or disabled tenant and they are like hoarding or cluttering or otherwise in need an APS services and they're at risk of eviction, they should have to report to, they should have to call APS and like screen whether the client would be a good fit and to exhaust all options, because we do have a legislative tradition, just cause, like you can't evict anyone without cause, like eviction protections 2.0, like, which like has a requirement to allow tenants to cure. So I could see this being an issue to be taken up by the Board of Supervisors.
Okay, Margot.
A totally different question, but just to respond a little bit, I know Sam Patel, who represents private SRO owners. He was really interested in hearing this presentation, so I'm sure there must be a big reason why he isn't here, but he had expressed how much he wanted to hear about this. And I can imagine that also the SRO collaborates might be able to play a role in working with the private SROs, because that's part of what you do, not and you probably already do. So what I had wanted to ask was, do you work with people that are homeless either because they end up not being able to stay where they are or being rehoused right away, which often is very difficult, or because somebody calls you about somebody who fits your eligibility criteria and is homeless?
Yeah. So, if it's an older adult, someone with a disability that is victim of abuse, we will work with them, physical abuse, exploitation, you name it. Now, in terms of housing, we will refer them to adult coordinated entry, to the existing resources to find housing, because it is a challenge, here in San Francisco, and our goal or role is to prevent people from losing their housing.
Right.
Adults with disabilities, older adults, that is very important to us. Now, if there were, for example, an adult with disability, an older person who has an organic brain impairment that is not a psychiatric issue, and they needed assisted living, we could help those if it is assisted living, like a board and care. That is different than independent living and finding a place or a room for them to live. So if all they need is a place to live, then the normal referrals, if it is assisted living that they need and they're willing to go into assisted living, and it is not a psychiatric issue that mental health has the mission to service with assisted living, then we will help those with organic conditions.
No, HSH definitely, I'm not trying to give you our work. I want to continue to collaborate with you. Just wondering, because people may stay homeless for a long time and might be in that situation, right?
Yeah.
So.
Okay. Juan Garcia.
Juan Garcia, for the record, thank you again for coming here. I really appreciate all the information you've given us. I have a question that is not necessarily individual based. It's more if a condition is created in a building that could potentially be found in a way that it's abuse towards tenants. If the sanitary conditions of the building are deplorable and individuals find it very difficult to use the facilities, if they are not cleaned every day, that they use their own room as makeshift facilities. Is that something we can call APS to come in and assist to help try to find a way to make private SRO or any other building clean or maintain those buildings in a sanitary condition so that it's not affecting tenants?
So the focus of APS is the individuals facing the harm. So in one sense, yes, you could call APS about concern about this and that individual. If it is about resolving a building issue, we wouldn't be the right agency, because we wouldn't, our mission or scope is not to look at, how well this SRO is providing for whatever they need for their tenants and what they're missing and so forth, and if they're older or dependent adults and so forth. So we would welcome a report on these individuals and be part of the resource referral to bring in the right local government agencies to address the issues with that SRO. So I don't know if that makes sense. We'll try to help them individually.
No, it does, and thank you for answering my question. DBI has been great in helping us try to abate some of these problems, the Department of Public Health as well. And I'm just trying to see if it can be used as a three-prong attack with some of these hotels that are habitually neglecting the facilities to either force tenants out in a forced eviction or force them in a state of like they're being neglected in themselves.
So those are health and safety hazards for sure, and it poses a risk of harm to this individual, especially possible homelessness, So what we need is names of individuals and what their unique situation is. Yes. So it's not just, go to this building because they're not doing X, Y, and Z. But these are the name of these, for example, other people, adults with disabilities. These are the concerns, these are their names, this is the location. Now we can open a case on each one of them because we serve individuals.
Right. Perfect. Thank you.
Other questions?
One more, I'm sorry, I'm looking at the time and everything, and I know you want to get to public comment as well. Just back to the caseload again. So of the 40, there's 45, and I'm just wondering, are they specialists in certain areas, or will a case manager just take on any case? Like, are there some that handle only financial abuse, some that handle only physical abuse, or does the case manager take on whatever the case is?
Yes, so each social worker is trained to deal with all types of abuse. We have a virtual unit for financial exploitation where there's a group of staff led by a couple of supervisors that meet with the police department and other local law enforcement and regional law enforcement. But they're not assigned to that unit. They bring cases or they have a portion of their caseload is about that. And our other group, the one that is specific for self-neglect, is the one through the Home Safe pilot, which is a pilot still, and we want this to succeed because we would like this to be enhanced and permanently funded by the state. So we really want this to succeed. And these specific social workers, all they do is self-neglect and eviction prevention. The rest also do self-neglect, but not with the intensive case management that the ones under Dwayne Vickery, that they have a capped caseload. So that's the difference.
Okay, thank you.
Where are you located?
Downstairs, on the fourth floor.
That was a long trip.
Yeah. Yeah.
Other comments or questions? Anybody else before we open public comment?
There is a motion I'd like to make. I don't know if we'd all be into it based on like some of the conversations I had. From what I've heard from here, I'm very concerned about private SROs and private housing in general, like landlords evicting people for hoarding and cluttering without contacting APS and doing like a screen like for senior and disabled. So I just want to make a motion to ask the Board of Supervisors to consider legislation that would require that landlords engage adult protective services before evicting an elderly or disabled tenant for hoarding, cluttering, and other issues, and allow all social service options to be exhausted in curing the issue before evicting a tenant. And I spoke with THC, an attorney from THC, and he seemed keen on that idea. So yeah.
Is there a second?
Second.
Okay, discussion.
So I think we need to make a distinction between what Jordan is referring to as a private SRO and a nonprofit SRO, and then there are the private and nonprofit SROs who are under contract with HSH, and then there are other private SROs that are just flat out independent, right? There's no city, shall we say, purview outside of I don't know, DBI and what have you. May I finish?
Sorry.
Yeah,
Just one
please let her
second.
finish.
So, like, speaking on behalf of an SRO that is under contract with the City and County of San Francisco, it's written into our contract that we employ all sorts of eviction prevention methods. So, I just want to say that I think we probably should not, I just want that to be considered.
Okay, thank you. What else? Other discussion? Margaret?
Do we have anyone here from the city attorney's office today? Oh, are you our new city attorney?
No, just for today.
Okay, just for today. Just for today, you're on city attorney. So I just wonder if we could put this on the agenda for next time and make sure that the representative for the private SROs is here, and city attorney is here anyway. But I just think that would be a good idea, and to do some more exploration in the meantime. I totally appreciate your motion. I just think there might be some more discussion necessary.
Would that include letting Peter take a look at this motion?
For example, yeah, some preparation outside of here would be great.
Yep.
I will, sorry about that, Dion, but I wanted to mention, like, it's under purview of, say, DPH and also the rent board, like, has, like, totally private, and I am going to withdraw this motion temporarily, like, in the interest of sunshine and just making sure that everyone can, yeah.
Jordan, you certainly know how to get the ball rolling.
Yeah.
Okay, so we will continue that to next time. Why don't we take some public comment? People have been very patient. Thank you. Yeah.
Well, a lot of my question has already been answered. I was wondering the appropriateness of calling APS if someone does not have a hoarding disorder, because some of these units out there are only like 60 square feet, and I think a normal you know, anybody with a normal amount of stuff is gonna look like they have a hoarding disorder. And it would almost take the opposite, like a minimalist disorder, to make it look normal. And I was just, you know, wondering, if APS, or if it would even be relevant. I mean, are there any kind of, you know, like any kind of data about the number of people that you serve that are actually do have diagnosed housing disorder, hoarding disorder, as opposed to people who are just in super cramped tiny spaces?
So what you're kind of getting at is maybe they shouldn't have been called in a particular case.
That, or maybe it just might be incredibly prevalent to have, you know, cluttering issues in our SROs, because some rooms are just so
Small.
tiny that everybody is,
Yeah.
by definition, those numbers.
So just by virtue that someone sees a problem or a hazard, now our social workers look into it, and then, you know, they begin to assess whether this is a hoarding, squalor, you name it. So it's not incumbent upon the person reporting to us to know and say, oh, this is hoarding disorder, therefore I can call. So you could call for the reason that this individual with very few little things is unable to secure food and dehydrated and seems confused, and haven't seen that person, you know, like being able to speak coherently. You're concerned, are they eating? So that type of, you don't have to have a clutter situation to call APS.
And actually, we have cases, a lot of reports regarding cluttered homes that are not due to hoarding disorder. It could be due to depression, could be substance use issue, could be many, many different other things. People suffering from hoarding disorder leading to that hoarding situation and report coming to APS is just a portion of the cases that we receive. And what you just described, because the place is so small and clients' belonging is piling up, as long as it's meeting within this fire code or safety code, is fine. Is when there's like safety issues, that's when the landlord or the on-site staff may want to bring someone in.
Okay, and could we go to APS to ask questions about what is in the fire code and the safety code?
Will be more the DBI and DPH.
We actually have it posted on our website at www.sfdph.org, what the fire code is and what DBI code is.
Okay,
But-
because
And the health code, right?
And the health code, we don't have violations for excessive materials because it's not a violation in itself, but excessive materials with cockroaches, with vermin, that is a violation, and we do address that. But just having a lot of stuff, like you said, I agree, it's not a violation in itself. So we do assessments as well, and then we make a determination on if you just need help, help moving things around or organizing it in a manner that will allow pest control to inspect and or treat your unit, that's perfectly fine. And that's usually what we get called in on, is actually too many items, and pest control can't do a thorough inspection of the unit. So we just try to help arrange that unit by elevating items or temporarily relocating them, so pest control can get in there, look around, and then put the items back.
how about overflow? Like, what if they have so much stuff that it's out in the hallway?
That's a fire hazard, yes.
And would it be a matter of degree, or would any item in the hallway automatically make you think that it could be a fire hazard?
That's a good question. I believe the fire code is 3.5 feet clearance, and most hallways are just about that. So if you put a bike or a wheelchair, you're usually within the fire code.
Or suitcases?
Correct. So for the most part, no, nothing's allowed in the hallway.
And would your office be the appropriate place to call about that?
Yes, definitely. Even if there are some violations that are not in our purview, we will make the referral to the correct department.
Okay, what else we got? And your name for the record, I'm sorry?
Chester's in the
Thank you very much. Well, that was very, oh yeah, one more.
Yes, my name is Cindy. I'm representing Ms. Clarion. I have found myself to suffer from hoarding periodically during my 5 or 6 years at 30 Sycamore Street, which is a private SRO. I have been diagnosed as chronically depressed because I'm suffering from gangs stalking from both the janitors and the management. I've caught them eavesdropping, I've caught them coming into my unit. I've documented over 80 breaking and entering into my unit. I'm now seeking help with legal aid for elderly to put in place an attorney. But my experience with Adult Protective Service was excellent, with the exception of when they came over, they had to step out of my room. They proceeded to take over $1,000 worth of antique books and threw them in the trash without me giving my consent. Other than that, I was very happy with all that they did for me. So I'm assuming that's what I'm going to have to do is call APS again on this situation. But my serious concern is the fact that I'm very depressed living there because I'm constantly stalked, both sexually and otherwise.
Okay.
And the landlord, at the time, who was Deepak Gandhi, had his lease taken away from him. So the problem is, because he was a crooked landlord, he has also hired crooked people. So I'm going to rally with the tenants to get signatures on this, even though there's a huge constant influx of new tenants. There are several tenants that have been there for quite some time now. They're willing to assign anything concerning this gang stalking that's been going on for a long time. They've mellowed out, but they're still doing it. So it's a very, very, very key issue, especially for women like myself.
All right, thank you very much. Appreciate everybody's participation. Thank you, Achilles, for coming by with the staff. Very helpful. So we just have a couple of things to run through before we adjourn. Next, we're in recess in August and September. I'm 90% sure we'll have the Food Security Network to come back and give us a presentation. We still have these items on the agenda that are possible future meeting topics. Does anybody either not see one that they would like to have, or doesn't feel like we should have these on here? Any comment on that? Okay.
I do. I just wait until that for everyone else, but I'm really hoping that we can try to get Mental Health Association in October. We should try to do one presentation a month, and probably Trans Home SF in November to tie in with the Transgender Day of Remembrance. I do like to do these things. We're just trying to get these presentations out of the way.
Could you help us arrange one of those?
I definitely could. Also, September seems to be the time when we usually put the directory before us and update it, so could be a pretty minor thing.
Thank you for reminding me on that one. Yeah, Cliff.
Cliff Gilmore for the record. I actually offered to work with one of the long-term members of the Mental Health Association to come to one of our task force meetings, so we've already spoken to him about that. So all we have to do is calendar it, and we'll be set to go.
So would October be okay with everybody if we shot for that?
Mm-hmm.
Okay. So that would be the Mental Health Association. Okay. Yeah, Dion.
Thanks, Jamie. I wanted to ask a question first for clarification before I suggest that we add something to our list of topics. So I wanted to just go back for a minute to the most recent legislation around the 30% tenant portion rent
Right.
payment that we,
The
this
subsidy,
body,
yeah.
that passed that. And I sort of became a member of this task force a little late, and I think that had already been an ongoing discussion, I'm not sure, but have we talked about what the reduction in tenant portion rent, what kind of financial impact that will have on organizations? Has
Well,
that been discussed?
Why don't we calendar an update on that
Okay.
subsidy issue?
Okay.
Any objection? Okay.
Yeah, I don't have an objection, but I structured this this whole discussion around the city chipping in and not trying to do anything to injure any of these nonprofits. So, but a subsidy update would be good. There might be legislation a couple months out, but since we're already backlogged, I'll reserve my comments for another meeting.
Okay, I'll go.
And I just want to support Jordan around that. I do think it's the job of HSH and the city to figure out how much money it is and how to come up with it, especially the city. I think the job of the task force was, to actually make the legislation happen and or make our ordinance or our recommendation or whatever it's called happen. And actually, I really appreciated the way that it was written, and so that it wouldn't assume that current dollar have to be used for it. Whether or not, the city can find the money is a totally different issue. But I think, I don't think that's the responsibility of the task force, other than maybe staying on top of the city. And I'm the city, staying on top of the city to keep on looking at that. But, yeah.
Just a response to that, thank you. And I'm just thinking that if we are going to ask, as a body, if we're going to ask the supervisors to consider this, could we not also inform the supervisors in terms of just what the financial impact is? I think it only makes us smarter about how this is going to impact. And I'm speaking on behalf of, again, I just got through, we're in the process right now of doing our rental certifications. And, I am building a budget around what I can expect in tenant portion of rent. And that can change, dramatically over time. So it's about just, helping to understand what this is. But it looks like we're going to discuss it more.
We'll be discussing more, so I gotta have to limit the comment there, okay? Because it's not on the agenda for this time.
Yeah. So
So
you've been asked to come up with a number.
I'm gonna move to the next item, which is the reports from, and I want to thank Adeku for her update already. And I gave mine, and now, do any of the collaboratives have an update that they want to share?
Clifford Gilmore for the record. One brief update I have is that yesterday Supervisor Matt Haney from District 6 attended a tenant meeting at your building, the Heartland Hotel. I was expecting you to see there for that, Jordan. But he actually did a constituent update on his time being elected to District 6, as well as fielding questions about community concerns and some announcements about what committee he serves on. He did touch upon the rent subsidies issue, so I'll reserve a comment for that when we have discussion next time. But one main issue came up is that every 10 years, police districts redraw their maps. And where the Heartland is on 99 Gary Street, it's sort of in no man's land between Northern Station and the Tenderloin Station.
Central Station.
Yeah, and Central is there too. So there will be at some point a meeting to sort of see how to address that those constituents in that area that right now are not really receiving police services.
Okay.
Yeah.
Anybody else? Any other yeah.
Yeah, Raul Fernandez Vargasabal with the SRO Families United Collaborative. We completed our 5th annual family leadership training. We have 25 participants, 25 of them graduated. It was really successful. Supervisor Haney was there in the graduation. Also last week, our organizers attended a code enforcement training facilitated by Juan Garcia from the Dolores Street Community Services. Very successful as well. Also, we have fully staffed all our peer organizer positions. We're in the process of completing our annual report, and we have far exceeded all our objectives. And also next week, on the 30th of this month, Juan Garcia and I are going to Redwood City to pick 800 pairs of shoes for our families.
Oh,
Wow.
I'm looking forward to getting the report. And
Yes,
reviewing
you got
it.
I've got almost 800 pairs of shoes in my closet.
All right.
I could imagine.
He doesn't go there, right? Why Redwood City?
Juan Garcia for the record. Just a quick update with Mission SRO Collaborative. We do have a new director. I think it was mentioned the last meeting, and we also have a new program manager for the Mission SRO Collaborative. And just a bit of an update on some of the work that we're doing. We're trying to focus more on working with landlords for the private SROs to try to abate some violations and try to come up with an agreement where tenants are not going to be affected negatively as long as we work in unison as long as the violations are not too severe before having to refer it to DPH or DBI. And it's pretty successful. Our biggest case is 1941 Mission Street, or the Grand Southern Hotel, which has had a long history of problems. So we're working on it, but the outlook looks pretty good.
All right, excellent. Okay, so is there any public comment on the collaborative updates? Is there
Actually,
any?
didn't take public comment on prioritization of future meeting topics, just...
Any public comment on future meeting topics? Before we take the general public comment. Okay, thank you for reminding me. Okay, now we are on item 8, general public comment. Anybody? And we always appreciate people come visit us who are not on the task force. The more participation we have, especially from people that live in SROs, it really helps this body to do relevant work. And again, I want to thank all the people from APS who came. And is there a motion to adjourn?
Just before, I'd like to make the motion, but before I make the motion,
Okay.
I'd like to see if we can adjourn today's meeting in honor of our own Jennifer's dad, who passed away recently. So with that, I'd like to make the motion that we adjourn the meeting.
Is there a second?
Second.
Jordan. So moved. Thank you, everybody. Next door neighbors.
All right. Can I get one of your cards too? Thank you. So, great presentation.
A couple years ago.
But he's in the office.
The attorney is back.
Or that's a different
Letters for every unit.
With children?
I just know you're
And all part of work here.
Oh, okay.
Yes.
I've been having a hard time. Most importantly, to actually talk to myself. Manny, I don't know what people are knowing. I've actually had to place my so I think her reputation and got a meeting.
Like, basically, I'm basically trying to think of anything that, like, APS could help.